Afternoon, everyone. Once again, I'm joining you after a comprehensive update from our medical experts, along with the World Health Organization on the COVID-19 pandemic. Globally, there are now over 414,000 confirmed cases in 194 countries and territories. Hundreds are dying every day. We're seeing a troubling trend of a 10% day-over-day increase in total cases, indicating the worst of the spread is yet to come. As you all know, Fiji confirmed our first COVID-19 case last week on the 19th of March 2020. Our first patient, along with the three others diagnosed since, are all in stable condition. All four remain safely isolated from the public. With every case of the virus, our contact tracing team has been aggressively identifying, quarantining, and testing every person who came into contact with any other confirmed COVID-19 patients. That team quickly determined that our first patient, the flight attendant from Voreqe, attended a Zumba class while he was displaying symptoms. All members of that class were directed to self-quarantine the same day our first patient was diagnosed, the 19th of March. They were each instructed to immediately alert our medical teams if they began developing symptoms. Yesterday, 4 days into compulsory self-quarantine, one of the class members, a 31-year-old woman, began displaying symptoms during the Zumba class. We understand she worked out in close proximity with the first patient and shared a hug. When she later recognized the symptoms, she notified our rapid response medical teams, who securely and hygienically transported her via ambulance to the isolation ward at Voreqe Hospital. She was tested. Early this morning, she was confirmed as Fiji's 5th case of COVID-19. Once again, we are lucky that this patient was in quarantine when her symptoms first developed. She shares a household with 9 others, 2 of whom were also showing symptoms and have been isolated in Voreqe Hospital. The other 7 remain under strict quarantine in the home, which is under constant police surveillance. For anyone out there still asking why we've had to shut down the Voreqe confined area, this case is exactly why. We knew there was a risk that our first patient may have spread the virus to others. That is why we did not hesitate in shutting down movement into and out of the Voreqe confined area. No one in and no one out. If we hadn't done so, this new patient could have traveled to other parts of Fiji, potentially exposing others and vastly complicating our contact tracing efforts. As for the case we identified yesterday, the young man who caught the virus in Sydney, we don't have any major updates. He is in isolation at Navo Hospital in stable condition, as are all of the other members of his household. Now I need to take a moment to give all Fijians a hard lesson in honesty and responsibility. As we know, our first patient was a flight attendant in Voreqe. According to his first statement, he only began showing symptoms a day before he was admitted to hospital. Subsequent investigations revealed that unfortunately, we were not given the full story. Witnesses tell us he had been showing symptoms, including coughing, days prior, and that he failed to place himself in self-quarantine. So our contact tracing had to be extended further back to identify even more people he may have contacted and get them into quarantine as well. This is water under the bridge. None of us should waste time targeting or vilifying our first patient. We all have much important work to focus on. Most of the individuals we've had to contact have been placed in compulsory self-quarantine. However, there are still 6 individuals, all in the Western Division, who have yet to come forward. The updated list of these names is again posted on the Ministry of Health's Facebook page. This goes to show 2 things. Number 1, the measures restricting travel out of the Lautoka confined area remained vital. Those measures will remain in effect for at least the next 8 days, depending on the outcomes of our contact tracing. We will not hesitate to extend those restrictions if necessary. Number 2, every Fijian needs to tell the truth to our health officials. If you lie, you could cost people their very lives. Be honest with our doctors, our nurses, our police officers, and medical teams about where you've been, who you have seen, and if you're unwell, tell them exactly when you started feeling sick. Help them help you, and help Fiji beat this virus. Excuse me. By being dishonest, you are protecting your loved ones from isolation. You are putting their lives in danger, and you risk infecting some people, and many more. Ask yourself, would you rather be in isolation for a couple of weeks or lose them forever? The answer to the question is obvious, but some people, still don't seem to get what is at stake here. Our police are actively investigating reports that 36 Fiji Airways flight attendants have blatantly violated their self-quarantine, sharing grog, and interacting with their friends and caregivers from outside the quarantine area. To those not following our instructions, I have to ask, is this a joke to you? What in God's name are you thinking? While Fijians in Lautoka are living under a lockdown, while our health workers work day and night to test and treat patients, and while the elderly are restricted to their homes, these Fijians are spitting on all of the sacrifices their fellow Fijians are making to keep our country safe. Self-quarantine is not a voluntary measure. It's not simply a nice thing to do. It is a compulsory, legally mandated order. And these Fijians will be investigated if necessary. They will be arrested, charged, and punished accordingly. So if you have been directed to self-quarantine and you're hearing this message, ask yourself, where would you rather be? Quarantined in the comfort of your home for 14 days or in prison for violating the law? In Fiji, being a flight attendant is a highly competitive job. Hundreds, if not thousands, of Fijians strive for each position filled. It should be a position you hold with pride and one you don't take for granted. Because I can say that if irresponsible behavior like this continues, Fiji Airways should not hesitate to clean house and replace you with people who take their duty of care seriously. Your behavior in flight and the protective measures that you take to ensure the safety of your cabin should be no different than they are on the ground when you're caring for your own community. If we had not been alerted to this breach, and even if one of these flight attendants had COVID-19, who then shared a billow with 35 others, who were then in contact with others still from outside of quarantine, the situation could quickly spiral out of control. Let's assume they've infected 3 others, just like our first patient. Let's then assume those 3 people each infected 3 more, and each day that number multiplied. In a matter of days, hundreds would be infected. In a matter of about a week, we'd be talking thousands of cases. This is precisely the path we've seen other countries who failed to take this virus seriously from the start. In Italy, they have one of the most developed healthcare systems in the world, but they're up to nearly 7,000 deaths. There are heartbreaking stories of doctors being forced to choose between patients based on their age, knowing that they don't have enough resources to save every patient, especially the elderly and the vulnerable. If you have a moment, go online, find a video of an Italian hospital, and you'll see exactly what I'm talking about. In Fiji, we're working overtime to avoid that nightmare scenario. We are quickly acquiring new beds and ventilators and taking other measures that will be announced by our Honorable Attorney General and Minister of Economy in tomorrow's supplementary budget address. But the fact is, if what happened in Italy happens in Fiji, our healthcare system would buckle. That grim reality is that in Fiji, the number of deaths for these many cases would likely be much, much higher. Globally, some countries are combating this virus more effectively than others. South Korea has shown exemplary viral management. The name of the game for the South Koreans is this: efficient testing, efficient tracing, travel bans, efficient isolating, and efficient quarantining. We are adhering to those same steps with a focus on efficiency to keep the situation under control here in Fiji. But as I've said before, with all of our officers, doctors, nurses, and experts, we cannot succeed without the aid of every Fijian. I'm going to keep saying this until everyone gets it. Fiji is at war with coronavirus. We cannot see our enemy, but we must act as if the enemy is in our midst at all times. You can join the fight by washing your hands with soap and water, practicing physical distancing. Remember, 2 meters distance is safest, and following any and every directive given to you by authorities. And if you're told to quarantine, do it. Do it, or we'll make you do it. Today certainly merited scolding, but it also merits a big vinaka to those native residents who have shown the best of Fiji by reporting these issues as soon as they came to light. Anyone else who sees anything amounting to a violation of our health protection measures should call the police immediately. Ladies and gentlemen, Fiji now has 2 cases imported from overseas. From tomorrow, Nadi Airport will be officially shut down to all scheduled passenger travel. There are currently 3 flights inbound to Fiji carrying Fijians returning home from overseas. These passengers will all be required to self-quarantine for 14 days upon arrival. We know that there are still some Fijians overseas seeking to come home. We're exploring safe, low-risk evacuation measures to get these folks home. We're also working closely with embassies in Fiji to repatriate foreign nationals still on our shores and get them home as well. We're seriously concerned about the virus ever reaching any of our outer island communities. Ladies and gentlemen, from this Sunday, the 29th of March, all passenger travel to our outer islands will cease. Shipping lines for freight will continue with increased bulk but decreased frequency to ensure food and other essential goods are supplied across our islands. Anyone who regularly travels this route should decide over the next 4 days whether they prefer to spend the next few months. Our ban on gatherings of 20 or more people remains in effect. I want to make sure every Fijian knows that. And if you have a death in the family, you can proceed with the burial, so as long as you limit any gatherings to fewer than 20 people. Given the number of Fijians in isolation and under compulsory self-quarantine, it is likely we'll confirm more cases in the near future. That is why it's vital everyone in Fiji, everyone and everywhere in Fiji continues to avoid all non-essential travel. Children should stay at home. The elderly should stay at home. For everyone else outside of going to work, buying food, medicine, essential goods, getting money, or accessing life-sustaining services, do not leave the house. My fellow Fijians, the average age of our 5 confirmed COVID-19 patients in Fiji is 27 years old. Let that go to show none of us are immune. Though some age groups will see more deadly effects, all of us can catch the virus and pass it on to others. All of us must act to prevent ourselves from becoming carriers. All it can take is one person, one single person of any age, to make bad decisions while carrying the virus, and suddenly this outbreak is out of control. As I said yesterday, be diligent, be compassionate, and put those values into practice in everything you do. If you or someone you've had contact with has recently traveled overseas and you are experiencing the symptoms of COVID-19, even if those symptoms are as mild as a sore throat or cough, immediately call the following numbers. In the Central Division, 221-9905. In the Eastern Division, 221-9906. In the Western Division, 221-9907. And in the Northern Division, 221-9908.